I got my bachelor's in nursing from Jacksonville University, but prior to that I had gotten a bachelor's in English at University of Florida, and decided later on I didn't know what to do and decided I wanted to be a nurse. So I went back to JU and eventually came to work here at Boudreaux Griever Clinic in 1996 and worked as a nurse in various capacities. I worked for a couple of the physicians in the office. I also did research. I was the first research nurse here at Boudreaux Griever. And then I decided to go to work at their endoscopy center, and which I did up until I decided to go back to school to be a nurse practitioner. So I decided to do that probably 2007 or 8, I believe. Went back to UNF, got my master's, and became a nurse practitioner. And when I came out of school, that's when Dr. Rawls and Dr. Kabi and Dr. Patel also offered me a job to work with them in the hospital mostly. And then I sort of transitioned to the office. So that's what I do primarily now, is work in the office, seeing patients for them. It's all about it's very patient-centered care. That, you know, everyone that works for the company knows that we have to do whatever it takes to take care of the patients the best we can. And I think everybody kind of goes over and above, you know, what's asked of them to do that. But it's very, very patient-focused care. Well, one thing is the quality care, but the other is the way that they're going to be treated when they come here. You know, I think some places tend to treat patients like they're numbers, and you're not going to get treated that way here at Boudreaux Griever. Everybody is treated with respect and treated equally. So I think that, you know, you're not going to see that everywhere. Well, worst part of it is the bowel prep. That's the day before the test, because you have to clean your bowels out before you do the procedure. But as far as doing the procedure, there's no pain involved because they give you medicine to sedate you so you don't feel it and you don't remember it. So most patients wake up and they literally don't remember a thing, and they wonder when the physician is going to do the procedure. So if they can get through the bowel prep, and actually the bowel preps are a lot better than they used to be. You don't have to drink as much, so that's a plus. So, and again, it's really worth doing if you can prevent colon cancer. So I recommend everybody have it. Well, because if you find polyps, which are what eventually become colon cancer, if you find them early enough before they turn to cancer, or, you know, close to being cancer, then, you know, you've saved the patient a lot of surgery and heartache, and, you know, you've really prevented them from having to basically deal with having colon cancer. So you just want, you know, you can get it early enough. Well, I have 2 kids. I have 2 girls. One's 15, one's 11. And so I have one just, my youngest just started middle school, my oldest just started high school, and they're into sports big time. So anytime I have, it's a volleyball game and a soccer game and a softball game, that's it. I don't have a lot of free time, and church also, a lot of church activities. Well, I just think anybody who comes here is going to be, they're going to be happy they came here because of the treatment that they get. They're going to get, you know, holistic care. They're going to be treated with respect, not just like a number. And if they come see me as a nurse, I tend to kind of treat patients a little bit differently, maybe, because I do have a nursing background, and I really do kind of provide holistic care. and listen to the patients, which I think a lot of patients have a hard time finding providers that they're comfortable with because they feel like they don't really listen to them. And I think that would be something that they would consider if they wanted to come see me.